Alright, so I got my BSI, putting my gloves on. The scene looks safe. I see one female patient, and I do not know what the mechanism of the injury is, but there's a ladder over there, so I assume it has something to do with that. My general impression is that she is lying very uncomfortably on the floor, and I need to ask her what is wrong. And I will call 911 as soon as I figure out if I need to. Hi, my name's Sarah. I'm an EMR. Is it okay if I help you today?
Yes, please.
What's your name?
Toria.
And what seemed to happen? What's the problem?
I fell down a ladder.
Oh no. Did you hurt your leg?
Yeah, I can't move it.
Try not to move your neck, because I'm afraid about your neck also. So I'll call 911 right now, because I assume a trauma injury and I don't know if her neck is injured or not. And if I had a bystander, I'd have them come and hold C-spine. So pretend somebody's holding C-spine. And I will start with airway. Is it okay if I look in your mouth to check? There's nothing there. Is it okay if I check your breathing? Alright, take a deep breath in and out. Alright, perfect. Seems equal. Can I check your pulse?
Yes.
I found a pulse. And is it okay if I check for blood all over your
Yes.
body? Alright. So I'm looking on the head, nothing. Looking back behind all this. Checking the sleeves. Checking here. Looks to be good. Checking these cuffs. Nothing. Right. Nothing. Is it okay if I expose your stomach to look?
Yep.
Nothing. Checking the cuffs for pooling. She already has her socks off. Check. So there's no blood. So I'm going to do a head-to-toe assessment on you now to check for any deformities and to find out what is wrong.
Okay.
I'm going to check your head. Feeling for anything. I don't feel anything. I'm going to check your ears and your nose for cerebral spinal fluid. I'm going to check your eyes. Can you follow my finger? Perfect. I'm going to check your bones on your face. Feeling for any deformities, open wounds, or tenderness, or swelling. Okay. And then can you breathe out so I can see if you have a fruity smell? Okay, you seem to be good. Now I'm going to check the back of the neck. And that is all good. And then your trachea and your jugular veins seem to be fine. And then I'm going to check the clavicles. Alright. And then I'm going to check your sternum. And your ribs. Take another breath in and out for me. Right. Okay. And then I'm going to check your abdomen. Can I expose again?
Mm-hmm.
Alright. And then is there anything wrong with your genital area?
No.
Alright. I'm gonna check. Alright, and then I'm going to check your legs.
That hurts right there.
Oh, alright. So I see deformity, so I'm going to get a splint. I'm going to splint her leg. And if it was a femur fracture, I would do, in the middle, I would do the femur traction splint. But it doesn't appear that way, so I'm just going to splint her whole leg. And then I will move on and do this leg. Alright, and now I'm going to check your toes to see if you have toes are a little bit cold. That's normal. I'm gonna check your pulse. And then I'm going to touch your toes and you tell me what I'm doing without looking.
You're touching the bottom of my foot.
Am I scratching or pinching?
Scratching.
And now what I'm doing?
Scratching. Or pinching now.
Okay, what about this foot?
Scratching. Pinching.
Great. Can you wiggle your toes for me? Perfect. And then can you push against my hands? Can you push up against my hands? Alright, so this one did not have any, so it could be because of this. I'll come up and check your other arm. Great. Perfect. And then can you tell me what I'm doing?
Scratching my top of the hand.
And now what I'm doing?
Just pushing, pinching on my hand.
Okay. Can you wiggle those fingers? Alright. And then, perfect. And then what am I doing?
Scratching my hand.
And now what I'm doing?
Pinching it.
Okay. Can you squeeze my fingers? You squeeze with this hand too. Squeeze as hard as you can. Perfect. Okay. Now I'm gonna roll you over onto your back while supporting your neck so you don't hurt your back more. And I'm going to check your back and the back of your legs. So, your head would have been straight. That's okay. So don't move, just lay on your arm as soon as I roll you over, okay? 1, 2, 3. Oh, keep your leg up. Like that, so it supports you. Okay. I'll touch each vertebrae. And your legs. Okay, perfect. Is this position uncomfortable for you?
A little.
Okay, we'll move you back. 3, 1, 2, 3. And now I will check your vitals. So what's your name again?
Toria.
And where are you right now?
I'm in my front lawn.
And how old are you?
I'm 20 years old.
I forgot to ask that before. And what time is it?
It's about 3 o'clock.
And what happened?
I was trying to clean the windows on my house and I fell off a ladder.
Okay. I am now going to check your can you use my watch?
Mhm.
Me too. 'Cause I need a pulse. Alright, her breathing is at about 20 per minute, and her pulse is about 82. It's okay. And then I'm going to check. So your skin is pale, warm, and dry. And then I'm going to check the responsiveness of your eyes. So you can close your eyes, and then If you can you look at the light when I tell you to open them? 1, 2, 3. Perfect. They're both, pupils are equally round and responsive to light. I'm going to check the petal pulse. Even though I checked it already. And I found her petal pulse. So I'll continue to monitor her vitals every few minutes, but now we're going to talk about her past medical history. So we're going to first talk about the signs and symptoms. So what was the onset? Was it gradual or sudden?
It was sudden.
Very sudden. And then we're going to talk, so your injury in your leg, does anything provoke it?
Touching it or moving it.
Touching or moving, okay. And then what's the quality of your pain right now?
I'd say it's about an 8 out of 10.
Okay. And then, so quality, like, is it unbearable? Is it? Shoot.
I'd say close to unbearable.
Okay. And then, does it radiate anywhere? Does it radiate down your leg or up your leg?
Down my leg.
Down your leg farther? Okay.
Yeah.
And then, does it, what is the severity on a scale of 1 to 10, did you say?
I'd say 8.
An 8?
Mm-hmm.
Okay, so 911 should be here soon. And then, about what time did it happen?
3 o'clock, about.
3 o'clock, and what time is it now?
I think it's about 3:30.
Okay. And, then we're going to talk about, do you have any allergies or anything to food, medication, plants, animals?
I'm allergic to peanuts, but that's it.
Peanuts, okay. And then are you taking any current medications, prescription, over-the-counter, recreational?
Mm-hmm.
No? Do you have any past or pertinent medical history?
I did get my tonsils out when I was 5. and I broke my arm once.
Oh, okay. It's good to know. And then, sorry. Oh god, what was I just on? Oh god, what is the next one? Okay, what's your last oral intake? What did you eat or
I
take
ate
last?
about 12 o'clock and I had popcorn. And then I went to the bathroom about an hour ago.
Okay. And did you go both 1 and 2 in the bathroom?
Yes.
Okay. And so what events led up to this injury?
I was cleaning a window and I saw someone throw a ball and I looked at it, and then last thing I remember is me waking up on the floor.
Alright, that's not very good. Alright, so I'm going to continue to monitor her vitals until the paramedics get here, and I'll make sure her leg is splinted and not moved, and I'll treat her for shock if need be.